to the show now. We'll dive in deep. Your health and the wellness in your hands to keep. Tips and tricks to know now. Stories that inspire. Living life with knowledge, set your mind on fire. Tune into the dot. Health from head to toe. Together we'll unlock the secrets you should know.
Well, Tiffany, thank you for coming on again. I think this is your third or fourth podcast with us. So we're excited for you now to be on video and people can see you, but also hear the great advice that you're going to have. So today's guest is Tiffany Pottkotter. She is a psychiatric nurse practitioner and professional clinical counselor here at Wind Up Memorial. And we're going to talk a little bit about Mental Health Awareness Month. May is Mental Health Awareness Month. And one of the initiatives we have going on this week is Break the Stigma and Wear Green Day on Thursday. So thank you, Tiffany, for coming on and being a part of this and truly embracing kind of the crazy that we have here, and I know we threw this at you extremely quick, but being willing to be a part of it and do this is really important to us. So thank you so much.
Thanks for having me.
So we're going to jump right in with the hard questions. We want to know what Mental Health Awareness Month means to you, not only professionally, but personally.
Well, personally, I've worked in mental health for 26 years. My first job was a group home with 13 people who had schizophrenia. And that really opened my eyes that these are people too, and they want to be loved, and it's just a disease of the brain. So that actually really fueled my passion for mental health awareness, because there was so much stigma around schizophrenia at that time. And being with them day in and day out, I thought, man, people don't realize there's so many great parts to them. And also I realized that people view mental illness as they characterize it with words such as crazy or dangerous or all those things. And that's not what it is at all. Mm-hmm. And so I really felt passionate we need to educate people better on this, because those are the barriers that prohibit people from getting help. So professionally, gosh, we've seen the world change, right? Over the last several years, we see so much division in our world and conflict over not just politics, but in schools and workplaces and employers and everywhere. And I do...
In healthcare.
Yeah, in healthcare.
Right? Yeah, it's a major one.
Yes. And I feel like the common denominator a lot of times is people aren't taking care of their mental health. And that's where all the underlying problems are. So if we all invest in ourselves and take care of our minds, we create self-awareness, we understand how we talk to people, we understand how to communicate, understand how to manage conflict. Gosh, our workplaces will be better, our schools will be better, our communities will be better. It's going to be like a ripple effect. But it starts with us. So
did you notice every single thing that she said? She directed it directly at me the whole time. We had eye contact the whole time, and it was self-awareness. It was knowing when to get help, all of that stuff. So I've caught the hint early already. So thank you so much. I'm totally kidding. But so absolutely, I agree with everything you're saying. Why is it so important that we continue to talk about mental health openly, honestly, and pretty clearly to not only internally here at the hospital, but to the community in general?
Because first of all, mental health encompasses a lot of different things. It's not just depression and anxiety. It's communication, it's mindfulness, it's self-awareness, it's our thought process. And all of these things ripple over into so many other areas that we really don't see that's having a huge impact. I think of schools, mental health starts with our children and the kids in the schools. And if the parents and administrators and people in charge don't have good mental health, they don't know how to problem solve or talk with kids or know when to identify mental health diagnoses, then what are we doing? And so unfortunately, mental health talk, the stigma has been there for so long that we have so many adults that come in that haven't developed coping skills yet. They don't have great communication skills. They still have social anxiety. They don't know how to manage conflict between people. And so these kids are not getting skills and tools. And so we have to break the cycle at some point. So the more we talk about it, we normalize it because there's mental health, physical health, and spiritual health. people have no problem sharing if they have a headache when they come to work. They have no problem talking to a friend and saying, yeah, I'm on my way to my annual, doctor's appointment to make sure everything's good. People don't really have a problem talking about their faith, perhaps, like their spiritual wellness. But why is it when we come to mental health, it's so hard to say to somebody like, I'm feeling so anxious today. My anxiety is through the roof, or I'm irritable. Everything's bothering me.
Yeah.
So like we have to normalize that and actually talk about it so that you don't feel like you're a person on an island going through something that other people, everybody goes through that stuff. So we have to make sure we normalize it so that we know how to treat it.
We've made, obviously, and I hope that you agree, we've made such great progress, in recent years talking about mental health, and talking, trying to break the stigma behind having mental health or talking about it or knowing somebody that has had it. So what is something, though, we still have so much further to go. What is something, though, that you think society still gets wrong about mental health?
Oh, man. There's so many stigmas out there. The biggest one I hear is that it's mind over matter, that like I should be able to do this on my own. And that like I'm weak if I come in and ask for help. And in fact, it's completely opposite. The strong people are the ones coming in and saying, I have some stuff I want to work on. I need to work through this. It's driving me nuts. I want to break a cycle. Maybe there's lots of generational cycles we are trying to actively break.
Yeah.
And so we just have to say like, that's great. I'm so glad you came in and worked on this stuff. Or the people in therapy are there because other people have hurt them that aren't in therapy. So they're the ones that are trying to come in and get mended from being broken from other hurt people that aren't taking care of themselves. So we have this stigma of like, I can do this on my own, or that only weak people can come in. I have a lot of people say, well, I have friends that I talk to. It's fine. They're my support system. I agree with that 100%. You should have a support system, but friends are not professionally trained. And
I was just getting ready to say, I'm sure some of the advice I give some of my friends, the textbook says no.
I'm sure it's great, Josh. But we want people to have friends, but professionals are trained and we have years of experience to ask the right questions, give the right tools, look at cognitive distortions, show you how to manage those cognitive distortions. There's lots of different things that professionals can do, or like diagnoses that we can tease out. Another stigma I see is medications all the time of I don't need or I don't want a medication to make me feel better every day. And so a lot of that is just misinformation. We have, TikTok and YouTube and all these things that people watch, and there's so much misinformation out there, and people have a hard time distinguishing what is real and what is fake, because you don't know who's standing behind those platforms. And so when they come in and say that, I break it down. I say, well, do you eat food every day? Because like I need protein to feel good. I need carbs to feel good. My food is my medicine to get me through the day. Or we just talk about the brain and like the function of the brain. And I say, we have chemicals in our brain, serotonin, dopamine, norepinephrine. And sometimes we are just deficient of those chemicals, or we have had trauma in our lives and our brain just says, I'm done making those. And so we have to jumpstart it by giving them the chemicals they need. So like it would be if a type 1 diabetic came to me and said, I just don't want to take insulin anymore. I don't want to have to rely on insulin to feel good every day. And I said, okay, well, your quality of life is going to decline, and that could lead to death. Your pancreas just isn't producing it. It's the same thing with your brain. Sometimes your brain just doesn't produce chemicals, and we have to help it out. And so there's no shame in that. There's nothing you did to warrant that. That's just the way you were born or just the way you were wired. And so just let us help you have a better quality of life.
Tiffany, honestly, I'm grateful for many reasons for you to be here. But for you to say that exactly right there, completely relatable, completely digestible for every consumer or listener or patient is great. This is not on script, but truly sitting here listening to you break it down so it is so relatable, it is understood, was amazing. So thank you so much for that. Sorry I stepped in front of you with your question, but it was honestly great.
Yeah, I think
not that I ever doubted you.
You've said the whole thing about like if a diabetic came in and they didn't want to take their insulin. Like I tell that to my friends all the time because like they don't understand that like there's nothing wrong with medication. Like you said, it's just our body. Like we just need something to kind of jumpstart the whole like feel good process. So like I use that all the time to tell my friends about, there's nothing wrong with taking medicine and all that stuff.
Interesting. People will take vitamins and all those things. Yeah. It's still medicine. I think it's just the medicine is attached to like making you feel better. Well, who wouldn't want to feel better? Like, don't you want a better quality of life? Or if you see your children struggling with maybe behavioral problems, attention, focus, ADHD, don't you want them to feel better going to school and be able to focus and be able to do well? Like it's just education is power. And so the more education we can get out there for people, maybe more people will come in and get help.
Mm-hmm. So if somebody is like hesitant or uncomfortable seeking help, how would you kind of approach them, or what would you say to them to kind of understand that it's okay to ask for help?
First of all, just normalize it. It's perfectly normal to feel hesitant and anxious coming in for your first time or a couple of times to get help. We understand that. We're strangers. We're asking you personal questions. We're asking you to be vulnerable and share things with us. But just know that there's nothing you're going to say that's going to faze us. We're trained to do this. We've been doing this for a long time. And so there's nothing you need to be ashamed of. And everything you tell us is confidential. We go over that. We 100% will keep your confidentiality unless you're going to harm yourself or someone else. And we go over all of that too. And that's one of the stigmas too. If I tell someone I'm having these suicidal thoughts, they're just going to hospitalize me. That's not true either. There has to be very strict and certain criteria for hospitalization. But just know that just come in and try it out. What you see on TV and on the movies is probably not accurate. Mm-hmm. So just come in, talk to us. If it's not a good fit for us or for you, that's fine. We'll transfer you to somebody else. Or if you present with something that we feel you need a higher level of care, that's fine too. We will refer you out and get you the level of care that you need. But just take the first step and get the ball rolling, because you won't know unless you try.
Yeah. So what are some simple, like everyday ways, everyday things people can do to help their mental health?
So it probably sounds monotonous, but get 6 to 8 hours of sleep.
No, not happening.
That's for Josh.
I got a checklist here. Not happening. Non-negotiable.
Right.
Can't do it.
Eat healthy. And when I say healthy, no one really eats healthy 100% of the time. It's just choose healthy food choices. Take care of your mind in terms of have a support system. Talk to others. Be involved. Don't be socially isolated. Like, have a good support system, but a healthy support system. I tell people constantly it's quality, not quantity of your friends. If you have 1 or 2 great friends, I am happy for you. You do not need a lot of friends unless they are good quality. Make sure your boundaries are tight, and make sure you are comfortable with saying no to people, because there's a lot of people pleasers in this world, and people pleasing can get you to a detrimental point if you're saying yes to everything and everyone, and then you feel overwhelmed. And lastly, being okay with people not liking you. That's a big thing. You just have to be okay. Not everyone in this world is going to like you, and that's normal and that's fine. And if everyone does like you, you're probably doing something wrong. You probably don't have boundaries. You're probably not having authentic conversations with people. You're probably not setting boundaries with people. So you just have to let it go. If someone doesn't like you, that's okay.
Which is so hard, because I think human nature is you want to be liked, yes. Right? And then being comfortable with maybe not being disliked, but having a difference of an opinion, yes. Right? I think, we talked, you said a little bit earlier about, there's you said it more eloquently than I'm going to say it. There's so much toxicity in the world, mm-hmm. Especially politically. And it's, if you are on either side of the aisle, instantly that person on the other side is a horrible person. Mm-hmm. They're wrong. You have to hate them. Yeah. When truly, in some cases, right? Yeah. You can be on opposite sides of the spectrum and still be a quality, genuine person. Yeah. And so I think that is disagreement doesn't necessarily have to mean that you hate somebody or you have to dislike them. You can truly figure out do I actually like this person, or is it just because I don't like their political affiliation?
Yeah, we have to learn to like coexist and work and get along with people of all different opinions. That's normal. And I also tell people we all have pieces and parts. We're like a pie chart. And so if I meet a new person, I might say, well, I like these pieces and parts. I don't care for this piece of you. It doesn't mean I don't like you. It's just that piece of you might be hard to get along with my personality. So I will still love on you and like you and treat you with respect. You just might not be in my circle of friends. And that's okay.
I imagine we're sitting at dinner, all right? They're going around and everyone's like, you look around like, I like this, and this, but I don't like this. Because that's the extreme to the boundary that I look at, right? As I'm just going to tell you direct to your face. I'm not a great boundary setter. So in my head, while you're saying that, I'm like, that's exactly what I wish I could do as a person, would be to sit there and be like, actually, I like these 3 things. Let me pull out my checklist. I like all of these and not these ones.
I want to verbalize it to the person.
Oh, it's great.
Oh, God.
But yes, you just have to have self-awareness of how do I feel when I'm around these people.
Yeah.
If they're people that bring out the best in you and they're a good support system and they laugh with you, keep them around. If not, then you are hanging out with the wrong company. You become the company you keep. And so you have to keep your circle healthy, and that will also promote healthy mental health too.
So when someone starts to feel overwhelmed in any circumstance, like what are a few coping strategies that they could do?
So in that moment, a lot of things are happening physiologically. When we're overwhelmed, our heart rate increases, our breathing becomes more rapid and shallow, our blood pressure increases, we're sweating. And so it gives you a sense of like loss of control of, oh my goodness, this is doomsday. So remember, we do have control over that. That's fight or flight syndrome. We can calm that, and we can start by deep breathing. So 5 deep breaths in through your nose, out through your mouth. That immediately calms that central nervous system that has been activated, and it gives you a sense of control because we are doing controlled breathing, which controls our responses. Going to a quiet place, getting away from a trigger or a stressor, calling someone, sensory things, so fidgets are nice. I keep those in my office. Just start squeezing fidgets, just start doing something distracting. So any of those things will help calm you down like in that moment, and just remember your thought process. We talk to ourselves all day long, right? We just have an internal dialogue. So during that time, you can either say like, oh gosh, I'm doomed. This is terrible, or you can say, you know what, this is going to pass. I'm just having a physiological response. I'm going to deep breathe. I have control. I'm okay. And so same situation, 2 different thought processes. One is going to build resiliency, and the other one is going to make you have doomsday thinking. So be mindful of what your thought process is.
So those are some coping skills and ways to be able to manage kind of mental health. But one of the initiatives that we're doing this week is Wear Green Day. So how important are community events like the Wear Green Day in the normalization of the mental health conversation?
So it's huge. And like you said earlier, it's not just May. It's every month that we want to do this. But wearing green is basically saying like, hey, we are here to break the stigma. We are here to talk about our mental health. And we have to do this for the betterment of our workplaces, our schools, our societies, our communities. Because when we invest and bring these problems to peak, we have schools that are more likely to invest in mental health resources. We can attract more mental health counselors and psychiatrists to the area because they want to come to an area that is passionate about mental health. We're going to attract more people to our area when we are talking about making a healthy community. We have insurance companies that are more likely to invest and cover mental health services when we say, hey, this is important. Like, this is really important to us. We got to get this covered in order for this person to have a better quality of life. We have employers that are more likely to have workplace accommodations and to address mental health issues because 100% of employees will have obstacles in their lives. They will have days where they might need a mental health day or they are just not well enough to come to work. So if we really say, hey, this is important, if you want that employee to stay and you want retention at a workplace, we have to recognize that mental health is a real thing. If we can stay home for a fever or vomiting or headache, we also should be able to stay home to be like, my brain is not right today. Yeah. I need to get it back on track. So the more we bring awareness, we're investing in workplaces and schools and communities, and we're investing in ourselves. And you have to look at investments if you get something on return. So you make the investment initially on yourself, you get the return in employee retention, you get the return in healthier communities and healthier schools.
I think you brought up TikTok earlier, so it's kind of my opening that I can talk about TikTok because it's what consumes my life. But one of the things, and I sent it to Jenna the other day, was everybody uses their sick time or their PTO when they're not feeling well, or, they have to take a kid to an appointment, all this stuff. But this person was like, why aren't we using our sick time or our vacation, our PTO on a nice day? It's a day where I'm feeling great.
Yeah.
And I don't want to waste it at work. Right. Right. So it's like, I would rather go into the park with my kids or something. And so I think that even is a way to help with mental health, and help with kind of the outlook on things, because I think that one is what sets us apart as an employer too.
Right.
Or as us as a department, because I have the ability to allow us to do that. And it's much harder if you're seeing patients or you're on the floor to be like, hey, it's too nice, I'm going home.
Right.
No, you got to stay.
Right.
But I think, it is one thing that's nice for us to be able to do is if you flex that schedule.
Yes, if you can make it work, flexibility is great. There's no badge of honor for hoarding vacation time. There's not. Vacation time is there to use and promote positive mental and physical health. So use it. That's what it's there for. And so if you get to the end of the year and you're like, oh, I only use 2 vacation days all year, I'm not going to celebrate you. I'm going to be like, what are you doing? Why are you not using that? So because we know with research, employees are happier when they have flexibility, they have time off, or even if something goes wrong with a family member and you got to go help them, it's great, because otherwise you're going to be sitting at work thinking about your family member all day long. If you have the flexibility to go take care of them, that's promoting positive mental health. Yeah. Right. So see,
you thought I was crazy being like, just go. Like, if you got something in your family, go. Like, it is, because I know me. If I have something in my family, I'm leaving. Like, all of this will be here when I will figure it out. Yeah. But like, I'm going. But there are some things where like, I don't want to miss, my niece and nephew's preschool graduation. I got to go and have lunch with them the one day. And that is one of the great perks here is I was able to flex my time around. And yes, we're a non-clinical department, so it's much easier for us to do that.
Right.
But I do know in every role here, we'll figure it out.
Yes.
Especially if we know, hey, my kids got a graduation, it's in the middle of the day. A lot of our directors will be able to figure out, okay, I can cover you for 2 hours.
Yeah.
Go and do that and come back. So that way we are helping the employee in creating a great work environment, but that's also what's helping with retention too.
Yeah.
Right.
If employees have that flexibility, because most people put family first, right? Because you're replaceable at work. And so if you're not putting your family first, or you don't feel like you can put your family first, then employees probably aren't going to stay, And again, everything's within reason. You got your job to do. You got to fulfill your responsibilities. But that helps people's mental health when they're not missing their kids' stuff or birthday parties or those types of things. It's like, if we all have positive mental health and good boundaries, we can all chip in to help each other,
I absolutely agree. So we talk about that here at Wind Up Memorial because we do have a different kind of model, right? But access to care can sometimes be challenging. What advice do you have for somebody who is seeking help, but is unfortunately on a wait list situation?
Yeah, so unfortunately that happens with mental health. So first of all, get on the wait list and then call 10 other places and get on all of their wait lists too. Just whoever called you back first, that's where you're going to go. Always ask to be put on the cancel list. We use that cancel list daily. So things come up, people call in, they might be sick or have something else come up. So just say, can I please be put on the cancel list? And we will call you. We might call you 10 minutes before, an hour before, and say, hey, we have an opening. Call your primary care provider, because sometimes we get calls from PCPs saying, hey, this is kind of an urgent case. I know you don't have any openings for 3 months, but can you somehow work them in? If we get a direct call and it's serious, we will probably work you in somewhere. Or PCPs are also trained in psych, so they can at least get meds on board if you need meds and bridge that gap. So while you're waiting to get into us, they can start something, or they can at least call us, present the case to us, and we can look over the chart and give a recommendation and say, this is probably what I would start them on. And now we're buying another 4 to 6 weeks. And so using all those ways to try to get in, we also promote like online platforms. So, virtual really took off with COVID, thanks to COVID. That's great. Not everybody likes it, but it does get you started. So, there's so many online platforms out there now. So just start doing it with somebody, and then, we can get you in. If that doesn't take off, we're happy to see you, but at least gets the ball rolling.
You talked about some of those online platforms. Are there any that you've seen reviews of, or that you've heard that are actually impactful and positive, have had positive experience with there? So I always see the ad for like BetterHelp.
Yeah.
So do you know, are there any of those online platforms that are a great resource for people?
I think they're all going to have mixed reviews based on who's writing the review, right? Yeah. If someone doesn't have a good experience, they're going to be the first one to go write a bad review. Just keep in mind, all the online platforms, you have to be trained and licensed. So it's the exact same certification and licensure required to see us in person. And so who you get, they have to be licensed in Ohio. So it'll be someone in Ohio. And I actually used to work for BetterHelp before I came here for a short time. And so I know the quality of work that I put into my patients, so, and sometimes even too, like something like BetterHelp, if you're not comfortable with like face-to-face visits, they do phone visits.
Yeah.
Where you just talk on the phone to somebody and you don't have to see them virtually. Or I had some people on BetterHelp that only wanted to type back and forth, which is, it's not ideal. But if you're not ready and you just want to take that first step of we just typed the whole time back and forth, and I would send them worksheets and they would send me worksheets back. So there's lots of different ways to connect with people depending on what your level of comfort is.
That's amazing. I think that I was looking at as we were planning promo for this month, I was looking at the 988 website.
Yeah.
And that was one of they had like 4 or 5 different ways that you could communicate with a professional. And one of them was messaging.
Yeah.
And I'm like, that's actually great that it's not just an email.
Yeah.
Or a form you fill out. It is, you can either do a video call, you can do just a voice call, you can message. They've made it so easy to receive immediate help, which was amazing.
Yes.
But one of the things that we're doing, and Tiffany, you've been here long enough now to see the growth that we've had at Wyandotte Memorial for our mental health team. When you first started, was it just you and Dr. Zara?
Yeah.
And so we have really expanded. So now we have Dr. Richards. We have Dr. Zara, who does telehealth. We have you. We have Belinda Longmore, who is also a psychiatric nurse practitioner. We have Caden Twining, who is a clinical counselor. We also are expanding the team, or trying to expand the team, and recruiting another mental health counselor and a mental health navigator that will really sit in the ER and help with navigating the services, our mental health services here, but also if you need to go to another facility. So the investment that we are making, that Wyandotte Memorial is making in mental health, is absolutely beneficial to not only our community, but all of our organization, because it definitely, you're not seeing the amount of traction at other organizations that we're having here. I know one of Kendra's big pushes is for mental health and access to mental health services here. So we definitely are excited to see the expansion. We're hoping that we get a whole lot of applicants for both of those positions that are posted because it's such a need here, and will make such a difference.
And that's a thing. It's a ripple effect. When your hospital and your community invest in mental health, we see the ripple effect. You just sent mental health boxes to schools.
Yes.
We're showing like, we care about you. We care about the schools. We care about the kids. We want early intervention. We care about the employees. And look at how much it's taken off, because we have administrators that care about mental health and are willing to invest in it. And so when people come to my office, I always say, like, what brought you here? And most of the time it's because they had a friend or family member come that had a positive experience, and now they're coming too. And so we want that ripple effect. We want our communities to be healthier, because this is a great place to live and work. And so we want to show we are your community's hospital, and we will take care of you.
Yeah.
Not just your physical health, but we'll take care of your mental health too. And that's obvious in all the people we're recruiting for.
And you're absolutely right. I mean, one of the ways that we engaged schools this year was we sent kind of PR boxes there with resources that we have here, stress balls and fidgeting items. And I think what was unique about us is we really work with 4 primary schools, right? Mm-hmm. Mohawk, Upper, Cary, and Urigal. Mm-hmm. But what we did this year was we went into Seneca County, we went into Hancock County, we went into Marion County, and we sent smaller boxes there with our information in it, but just information about begin the conversation, mm-hmm. right? Start the conversation at your school. Start having, breaking the stigma. By doing that, we're not necessarily looking at it as a recruitment tool. We truly want to just bring awareness to everybody, because it is such a need, especially in schools, and especially in all of those kind of more rural communities. Yeah, so sure. Thank you though for being kind of the champion for this too, lighting the fire under our ass to get us moving on that. So I definitely, seriously, really appreciate it, and I know that we, Jenna and Jill, turned things around extremely quick this year, and we were able to do a really quality month. Yeah. But knowing kind of where we want to be, and where we're going next year will be even better. So I really appreciate that.
Sure. Do you think people are truly getting better at talking about mental health, or like, are we just getting better at posting it online?
Probably both. Yeah. I think online has created like safety. You know, when people are behind a computer, they're more likely to say something versus in person. So I guess it's a start. It's a step. If you're willing to like post something online, great. But that's not going to get you the help that you need. You need to like come in person or talk to a professional to really. So my 3 social media posts that I post on my personal page in the month of May isn't all that I need to do. Counts. That's helpful. But just even, I guess there's so many people walking around that you would never know are struggling with something. Like, you never know what people are dealing with. And so when that person at least posts something online and says, hey, it's Mental Health Awareness Month, somebody might read that and be like, oh, wow, like they're taking care of their mental health. That's great. You know, they're in a respected position, or they're not afraid to talk about it. That might just be enough to get somebody else in, you know? So, and when we just keep planting that seed of like, talk about it. We all know somebody who's struggling right now, whether it's a friend, a family member, a coworker, a kid, or a friend's kid. You all know somebody. So it doesn't hurt to just go to that person and say like, hey, I know we've been talking about your kid's behavior issues for a while, but it is Mental Health Awareness Month. Like, now would be a great time to just get an assessment. Like, who cares? Just go get them assessed and see what's going on, you know? So, Tiffany, you and I were talking last week and going through kind of the items for the month. And we talked about one of the social media posts that I think went up over the weekend, that talked about, you know, people are struggling, reach out to your loved ones. And so I was like, you know what, there's a friend of mine who I haven't reached out to in a while. I need to reach out and just see how they're doing. I reached out to that person. They're like, you know what, I have been struggling. Thank you. I need resources on how to talk to a professional. Do you have any of those stuff? I wasn't using my friends as a recruitment tool. But I was like, you know, we have great mental health, a great mental health team here, but also there are so many great online platforms there. Just get the help that you need. It made me really look back into myself and say, you know what, I shouldn't be reaching out just after a random conversation you and I had. It's more about, staying more in touch with them, making sure that truly my people feel good too. It definitely
really made me feel good.
Yeah.
But also I'm glad that maybe when nobody else was reaching out, at least I did. So thank you for that.
Yeah, we have to take care of each other. You know, we don't want to turn a blind eye to someone that's clearly like struggling, or maybe someone has a chronic illness and they look like they have it all together, but you might reach out and say, hey, how's that going? I haven't talked to you about it in a while.
Yeah.
Because they might actually be struggling. They just, they don't want to bother anybody. You know, they already feel like they're a burden to everybody else around them. The last thing they want to do is talk about it, you know.
Everybody wants to put the smile on.
Yeah.
Right. And as I say with a smile. And I think that is nobody wants to be the burden. Nobody wants to be down. Right. I don't think anybody wants to have the struggle that kind of the stigma comes with. So having the conversation, reaching out to your loved ones, to your friends, and checking in on them, because life's tough.
Yeah, and your friendships develop because of authenticity, right? Nobody wants the friends that have it all together. And every time you call them to vent, they're like, oh, life's great. I'm organized. I'm on time. And you're like, okay, never mind. I want the friends that are a train wreck sometimes saying, I'm having a rough day. My anxiety's through the roof. My parenting is not great today, because that's authentic. And then I can relate. And then that makes me feel way more comfortable and vulnerable that I can speak up and saying, yeah, I'm having a rough day too.
I have one friend that I always call when I'm having the crash out, right? Because I know she gets it.
Yeah.
Like she gets it. I called her the one day and I'm like, listen, this is what happened. And she's like, you don't have to tell me. I know you're right. And I'm like, thank you. It's exactly what I needed. Like she knew, like, but I mean, so I explained the situation to her and she was like, no, you're not wrong. And so then like, I'm like, okay, I need you to really tell me, like, are you just like gaslighting me up, you know, like, you know, I teach, she's like, no, like that is, it's warranted. So I think it, and then she went in the next week, she was having a big event at work and she called me and she's like, it's my weekly crash out. And I'm like, okay, like I'm the one, you're not wrong.
And that's good. That's authentic.
Yeah.
That's how we like become closer to each other. It's like we share our struggles and help each other. Like that's how solid relationships are formed. Like that's great. I love to hear that stuff.
How do we make sure the conversation around mental health continues just after the month of May?
So obviously it has to be like year round. You know, May is just our promotion month because that's what society has said. Like that's the month we're going to talk about it. But boundaries have to be 12 months out of the year. Vulnerability has to be 12 months out of the year. Us being kind to ourselves and our inner dialogue has to be all the time. Constant self-awareness, self-reflection has to happen frequently. You know, we should always be self-evaluating. We should always be evaluating our circle. You know, if your circle is not healthy anymore, then you have to reevaluate your circle. That has to constantly take place. You always reevaluate your workplace, your employees, your employers. Like all of that has to be reevaluated and make sure you are always healthy, because our environment is ever changing, right? We're always getting new friends, new teammates, new coworkers, all those things. So you have to evaluate on a regular basis and saying, are these people still healthy in my life? If not, do I weed them out? What do I do? You know, I mean, we use the garden analogy.
Weed them out.
Right. We use the garden analogy a lot with work, and we say, what's your foundation? And your foundation, it might look different for everybody, but most people will say maybe it's your faith, your family, your friends, you know, your morals, your ethics, your values, those types of things. And so we should constantly be planting seeds in a firm foundation. And so if you start changing things in your foundation, your seeds aren't going to grow. And you have to say, like, well, what's watering your seeds? Are you growing as a person? If I'm not growing as a person, I have to look at who's around me in my garden. Do I have anything that's trying to weed me out? And it's not just people. It could be things that are weeding you out, you know, like maybe jealousy or envy or, you know, those types of things. Do I have the right resources? Am I getting enough sleep or exercise? Because that might be disallowing me to grow too. And so we also have to recognize we have different seasons, just like a garden has different seasons. So what season of life am I in? And is this allowing me to grow or not? So it's constant reevaluation of your foundation, the people around you, what's hindering you, what's allowing you to grow. And it's just you're constantly pruning your garden and trying to make it better and better each month or each year, So that's your biggest thing that I tell people to do year round, because so many people get stuck. Well, this has been my friend for 20 years. I've worked here for 30 years. That doesn't mean it's healthy anymore,
Yeah.
Or maybe this boundary used to work, that boundary no longer works for you. So it is a lot of introspection, and we can teach you how to do that if you come to see us.
That was great.
Yeah.
Again, all directed directly at me. This is no longer working for you. This is no longer working for you. It's time to reevaluate all of those things. But no, Tiffany, thank you. I know I joke about it, but thank you so much for being a leader here, and really pushing us to focus a lot on mental health and access to care here. So thank you so much for coming on. Thank you for bringing this initiative to us. And we are so excited to continue to work together, and just really break down the stigma and continue this conversation outside of May. So thank you so much.
Yeah, thank you for having me.
Tune into the dot. Health from head to toe. Together we'll unlock the secrets you should know.